Osteoarthritis, or OA, of the hip joint is a degenerative joint disease in which the cartilage that cushions the ends of the bones in the hip gradually wears down. This leads to pain, stiffness, reduced range of motion, and sometimes inflammation in the hip joint. OA is a chronic condition and typically worsens over time. Stages of hip osteoarthritis. Stage 1, minor. Minimal wear of the hip joint cartilage with no significant symptoms. Minor joint stiffness and discomfort might occur after activity, but it's usually manageable without medication. Stage 2, mild. More noticeable cartilage breakdown with mild pain and stiffness, particularly after periods of inactivity. People may begin to experience discomfort after extended physical activity. Stage 3, moderate. Significant cartilage loss, joint space narrowing, and more noticeable pain and stiffness. Pain may occur even during daily activities and may become more persistent. Some bone spurs, also known as osteophytes, may form, further restricting movement. Stage 4, severe. Severe cartilage loss, causing intense pain even at rest. Bone-on-bone contact often occurs due to near complete cartilage erosion, and joint function is severely limited. Bone spurs are more pronounced and inflammation can be constant. Conservative or non-surgical treatments. Physical therapy. Targeted exercises to improve strength and flexibility around the hip joint, helping to support the joint and reduce stress on it. As a physiotherapist, you may focus on strengthening the hip abductors, core, and lower body stabilizers while improving range of motion. Weight management. Reducing body weight can decrease stress on the hip joint, potentially slowing the progression of osteoarthritis. Pain management and NSAIDs such as ibuprofen and acetaminophen can help reduce pain and inflammation. Topical analgesics may also be used for targeted relief. Assistive devices like canes, crutches, or walkers can help offload pressure from the hip joint, especially in advanced stages. Lifestyle modifications are essential. Avoiding high-impact activities that stress the hip joint, such as running, and opting for low-impact activities like swimming or cycling can be quite beneficial. Injections, such as corticosteroid or hyaluronic acid injections, may reduce inflammation and provide temporary pain relief. However, these are typically recommended only for moderate cases, as frequent injections can have side effects. Surgical treatments. Arthroscopy. This minimally invasive surgery is used in early to moderate stages to clean out loose cartilage fragments and other debris, which may help relieve symptoms in some patients. Osteotomy. In cases where hip deformity contributes to the osteoarthritis, surgeons may reshape the hip joint to better align it. This can relieve pressure on the joint and delay the need for a hip replacement. Total hip replacement or arthroplasty. For severe cases where conservative treatment fails, total hip replacement is the most common surgical option. The damaged hip joint is replaced with a prosthetic joint made of metal, plastic, or ceramic. This surgery typically has a high success rate, improving pain and mobility significantly. Hip resurfacing. In some younger patients with severe osteoarthritis, surgeons may opt to reshape the damaged joint surfaces and cap them with metal. This procedure preserves more of the patient's bone and may make future hip replacements easier if needed. Each treatment approach is personalized depending on the patient's symptoms, age, activity level, and overall health. Hit that subscribe button if you like the content and would like to see more.